Brahmanam is the cancer model which I have made. Cancers are having an unavoidable cell growth which forms a tumor. Here I describe about the stem cells. Stem cells are those which present in our body, but in the case of cancer, the stem cells will grow and damage and they divide uncontinuously. They form a sphere type which is called a tumor. This is a flashcard which I have made. In this I have written all the symptoms and treatment of the cancer. Symptoms of the cancers like dysphagia, anorexia, weight loss, etc. Articles about the food processing, the varieties, physical health and nutrition facts, etc. My topic is about hemodialysis. Hemodialysis is used for the treatment where the kidneys are not functioning properly. This hemodialysis is done in the hospital where it takes 2 to 3 hours. In the hemodialysis, it is used for the kidney failure patient. First, the doctor will put the cream or a spray to numb the area and then insert the needles into the atrial and venous. Then atrial removes the blood from the body and sends to the dialysis and pumps into the dialysis filter. This dialysis filter has two parts. One is to help the blood pressure and the another is to wash the fluids. This dialysis filter the blood and sends into the filter blood is sent into the body again and the waste products are removed out waste products are like urea, creatinine and potassium calcium from the dialysis machine. Thank you.
This is peritoneal dialysis, in which they employ a bag for the effluent. So the effluent flows into the peritoneum and uses the peritoneal membrane to exchange toxins and electrolytes, and then the exhausted effluent with toxins and exhausted electrolytes flows into the feed bag. That is it.
In the Alzheimer brain. What is Alzheimer? Alzheimer is nothing but it is a neurodegenerative disorder. It is nothing but loss of a neuron. So due to the loss of a neuron, the overall function and overall size of a brain gets shrinkage. Now you can see this is a normal gyri and cell cave. Now due to the shrinkage of brains, you can see the gyri is getting elongated along with the cell cave. You can also see that the ventricle is also getting large in Alzheimer. What are the main two players which cause the Alzheimer are A beta plaques and tau neurofibrillary tangles. What is AB plaques? It is nothing but the accumulation of AB protein in the neuron, in between neuron, which will form impaired memory loss. This is a major sign and symptoms. Now this is a flashcard. This flashcard is about all what I explained, the pathology and causes along with the risk factor. And this is the pamphlet. It shows the early signs of Alzheimer and also how to reduce the risk of developing Alzheimer's. Thank you.
The topic chosen for presentation of visual aids is atherosclerosis. It is a heart condition that is caused because of coronary artery disease. Heart problems are mainly classified into 3, which is muscular, valvular and vesicular. Muscular disorders are because where the muscular layer of the heart is getting affected. For example, pericarditis. Valvular diseases are where the valves of the heart are getting disturbed. For example, vascular stenosis, and valvular disorders are where the larger vessels of the heart are getting disturbed. Example, coronary artery disease and atherosclerosis. Atherosclerosis is a coronary artery condition where the coronary artery of the heart is getting blocked and the arterial wall of the heart is getting thickened, mainly due to accumulation of several fatty materials. These fatty materials here are represented in yellowish color. This fatty material is caused due to deposition of certain substances like lipids, cholesterol, triglycerides, protein, or either calcification of calcium. In this model, there is a difference shown in the normal blood circulation and the circulation when the plaque formation is done. The pathophysiology and the development of plaque is given as initially atherosclerosis is a slow progressive disorder which is not acute, though it is caused chronic. It starts from the early childhood. The stages of plaque development goes as follows, where the complete red is shown in the form of a normal artery blood flow. The development of fatty streak is seen in an incidence of around 10 to 20 years of age. This fatty streak is mainly due to accumulation of intracellular lipids, which further develops into fibrous plaque where there is external accumulation of intracellular lipids along with other cell arteries and foamy cells. The fibrous plaque is further developed into plaque formation. This plaque formation completely blocks the artery, which is leading to narrowing of the lumen. If the plaque consists of fatty material like cholesterol, triglycerides, calcification of calcium and even fibrin. Coming to the chart display, this is completely focused on the surgical management and the dietary management. Apart from these both, there is a drug management. It is the first line of management where the drugs like statins are used which lower the LDL levels of
The dietary management of atherosclerosis. The principle of the diet is the diet therapy remains the first line of treatment for patients with high blood cholesterol. Low calorie, low fat, low saturated fat, low carbohydrates, and normal protein, vitamin, and minerals are recommended. Increase in fiber and increase in antioxidants is also recommended. Those patients whose weight is at a desirable level of its normal to height and weight is permitted a maintenance level of calories during convalescence period. In case of obesity, usually 1000 to 1200 kilocalories per day of calories is recommended. Restricted fats, not more than 20% of the total calories, should be consumed. Carbohydrates like complex carbs must be included and simple sugars are to be restricted. Carbohydrate intake should be reduced to restrict the calorie intake. Increase in fiber rich foods and antioxidants, normal intake of vitamins and minerals.